Before I affiliated with Heartland Dental, I was working, some people will say they work 7 days a week. I literally worked 7 days a week. I had multiple practices, and it was nonstop from, accounting, from team issues to audits. If you name it, we've done it, and it was extremely stressful. In my case, I worked with my family. I had a brother and father who also worked in some practices, in the 6 practices we had. We were all partners. I kind of ran the practices myself, but we were all looking for different things when we affiliated. My father had a medical issue, and they gave him some medications, and the next day his hand started to shake. He literally couldn't hold on to the handpiece anymore, and this was somebody who thought he could work and practice another 15 years. He loved it. My brother had some personal family health issues as well. He was looking for some ways to have a little bit less stress in his life and be able to travel because of these health issues. They had to go to a particular doctor in North Carolina. For me, I was looking to just not have to work 7 days a week, and I needed some help. And I was still looking to play a bigger game, and Heartland obviously is doing such a great job. The reputation at Heartland Dental is amazing. If I wasn't affiliated with Heartland, I guarantee you I just probably wouldn't have the time to be there for my family. Before affiliation, I struggled every year to try to figure out how are we going to get this practice to grow. Every year we were fairly successful in growing it new patient-wise or retention-wise. But with Heartland, we set goals every year. And what's nice about it is we can call or email about 1,000 doctors, and instantaneously get ideas. That's really what we're trying to do. We're trying to bring the dental community together. And I think everybody realizes that in the past, again, my father's a 1973 grad of Marquette. And back then when you started a practice, you didn't really talk to anybody else. If there was another dentist down the road, you guys didn't talk. It was kind of constant fighting. And that's what I love about Heartland is everybody's talking and everybody's sharing. And that's not only good for the doctors, but more importantly, it's really great for the patients. So because we were a bigger company per se in terms of just not being a solo practice, and when we affiliated with Heartland, in terms of training and onboarding, again, I keep saying this before, but it was so smooth. We have practice administrators behind the scenes that are helping our office managers, and office managers are helping your business assistants. So the structure of it just grows itself. There's not a lot that I have to do and worry about on how are we going to, make it to the next year, and what are we going to do to actually grow this company. With Heartland Dental, HR, marketing, big time on marketing. I'm sure we wasted hundreds of thousands of dollars on marketing that didn't work, and we just didn't know. With Heartland Dental, after the affiliation, their marketing department is amazing. They keep track of everything. They know exactly what to do. Anything you can think of, they're doing it, and they're doing it probably 3 or 4 times better than I could ever do by myself. Part of what I wanted to do was to build the state of Wisconsin. We didn't have really any practices for Heartland in the state of Wisconsin, and I was excited to join because I wanted to help really the healthcare of Wisconsin. I felt like if Heartland could get in there, we could maybe increase not only our patient care, but what we're being able to do in terms of cosmetic stuff like Invisalign and veneers and all the stuff that we're taught through Heartland Dental's excellent CE courses. In terms of expansion, we're doing it. We're all over the place, and I'm also helping in Louisiana, Nevada, South Dakota. So in terms of my dreams and aspirations of building Wisconsin and increasing healthcare, it's already gone way over. I'm already into multiple states with Heartland Dental, so it's quite an amazing journey. Not only do they care and they really want you to succeed, but you have to also understand that sometimes you can have something like a practice to sell or an exit strategy, but if you don't actually do it, the next day you may not have anything. And not only did it happen to my father, but just somebody down the road for me a couple months ago had called me and said, hey, I've been out of practice for 6 months, I can't go back, and now I can't sell my building, I can't transition my practice because the patients have all left. So that kind of really hit home. You really have to start looking at this, and Heartland Dental has really a lot of the solutions to make this very smooth and to help you out. The growth of Heartland that I see for the future is, I certainly understand that there's some risks out there in terms of some people thinking that we're going to overtake solo practice, and that's not going to be a good thing. But I'll tell you, the areas and the people I've talked to that work with Heartland Dental are only looking out for the doctors and the care of the patients. And I think the growth of it is, really the sky's the limit. We're going to have practices in pretty much every state soon. And again, we're really here just to help doctors to become successful and to take care of their patients. There's no hidden agendas or anything like that. We're just here really to make it easier for a dentist to practice dentistry.